evening, everybody. We'll be talking about a very interesting topic. Now, during your course and during this tenure, this medical and surgical emergencies is the utmost important because this is what the actual scenario which we are going to deal. If we talk about, these medical emergencies, there's a long list, but we'll be just taking the 10, 14 of the topics which are quite interesting and most important. So I'll be just starting with one by one without wasting much time. Come is your chest pain. Now, chest pain is a common concern with a wide range of potential causes, including serious and medical conditions. Chest pain is a very common presentation in the clinics in the hospital. And may I ask you that what is the most common cause of this chest pain? If you sit in whenever you start practicing, going for your trainings in your emergency rooms, you'll find maximum it is cardiac and the non-cardiac, both. If I talk cardiac, it is MI or ischemic heart disease, which tops the list. If I say non-cardiac, then it is gastrointestinal causes, which tops the list. So let us understand, when I say type of a chest pain, one is visceral and another is somatic. Now, visceral, the pain will be, something like vague. It is not pinpointing. It's a vague pain, dull, deep, squeezing, pressure, some kind of a pain. So this is, a typical pain of a ischemic heart disease. A somatic pain is your localized, sharp, stabbing, poking pain. So chest pain, as I said, is one of the most common complaint in your emergency department. And acute coronary syndrome is the maximum, which has been recorded in most of your emergencies. As I said, 31%, you can see the slide. And you can see the other common cause, 30% is your GI reflux. What do you mean by GI reflux? That's a gastrointestinal reflux. Because of your hyperacidity, there's a reflux of the gastric contents into the esophagus, and that causes such a burning pain. And on the third number, we have a musculoskeletal, and definitely what you need to ask in the history in case of trauma, any case of anything, pushing or pulling up something heavy for the last 2-3 days, you'll come to know the musculoskeletal, or doing a heavy gymming is a musculoskeletal cause. So what I'm trying to tell you, whenever a patient of a chest pain comes to you, you have to see what is the commonest cause. I said 31% is your acute coronary, second is your GI reflux, third is your musculoskeletal. So you have to take a history in such a fashion. What kind of a pain is it? A somatic pain or a visceral pain? Just take a history. As I said, that visceral is a dull aching pain and somatic is a pinpoint pain. So history and physical examination is very, very important whenever you are asking about a heart pain. After your physical examination, you have to again, as I said, start seeing the patients, check all the vitals, see his general appearance, how is he looking, check his, skin, whether the peripheries are cool or the warm. Look for the neck examination. Do not forget the vein prominences in the neck, because the vein prominences in the neck can be a cardiac cause. The vein prominences in the neck can be a respiratory cause. So this is just your eyes can pick when a patient, that means same time you're taking a history, just look at the patient and just see what is his appearance, what are his vitals in the monitor, what is his jugular vein distension or neck vein distensions, what about you just open his shirt and see what is his chest looking like. So all this is a very important general physical examination, followed by a particular systemic examination, whether it is a cardiac or a respiratory or an abdominal examination. Once you have done with it, depending upon the history and the physical examination, you will have to order, especially in cases of a chest pain, don't forget to order ECG, which is very, very important. X-ray, yes, if your findings, physical examination supports you. Basic investigations in the blood needs to be sent. Advanced investigations like CT pulmonary angiogram and your scintigraph scanning is to be done only once you are, suspecting such cases. But the basic examinations like your BNP and troponin levels should be immediately sent. And any time troponin, more than 1.4 seconds tells you that it may be a cardiac involvement. So that's what I was given a task to talk with you, and I would like to finish it. Thank you so much. Any questions? I'm happy to take.